Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you suspect you have rheumatoid arthritis, one question keeps you up at night. How much does the test actually cost? And can you get one without waiting months for a doctor's appointment? Today, we're breaking down exactly what RA blood tests are, how much they cost, from doctor's office to online labs, and the step-by-step process to get tested. Whether you're managing joint pain or just want real answers, by the end of this video, you'll know exactly where to order and what to expect. Here's what Mayo Clinic and the NIH actually say. Unlike osteoarthritis, which comes from wear and tear, RA is an autoimmune condition where your body's immune system attacks the linings of your joints. This causes inflammation, pain, and eventually joint damage if left untreated. The CDC reports that roughly 1.3 million Americans have RA, and it's 3 times more common in women than men. Early detection through blood tests can catch RA before it causes permanent damage. That's why testing matters a lot. The NIH and Mayo Clinic identify several key markers doctors look for. First, rheumatoid factor, or RF, an antibody that flags joint attack patterns. Second, anti-CCP, which is even more specific to RA and often the earliest sign. Then ESR, erythrocyte sedimentation rate, measuring inflammation levels. And CRP, C-reactive protein, which does the same thing. MedlinePlus notes you don't need all 4. Your clinician picks based on your symptoms, but the gold standard is usually RF plus anti-CCP. That combo gives the clearest picture. Here's the money part. At a traditional doctor's office, after the copay, RA blood work typically runs $200 to $800, depending on which tests and your insurance. Online labs like Quest or LabCorp's direct-to-consumer panels run $150 to $400. No insurance needed. Some sites bundle RA screening into wellness panels for $100 to $300. Mayo Clinic and Cleveland Clinic both note costs vary wildly by location. The upside: direct-to-consumer labs are often 40 to 60% cheaper and way faster. No weeks waiting for appointments. The process is straightforward. You'll have blood drawn, usually 2 to 3 vials from your arm. Takes about 5 minutes. Samples go to a lab for analysis, typically 3 to 7 business days for results. According to MedlinePlus, labs run your blood through machines that detect antibodies and measure inflammation markers. If you go online, many labs let you walk into any local collection center. You book online, show up, get drawn, and wait for results via email or their app. No doctor appointment needed for the test itself. If you want to skip the doctor's office, direct-to-consumer labs are your fastest route. Quest Diagnostics and LabCorp both offer online RA screening. You go to their website, select the RA panel, pay online, book an appointment at a local draw site, and go get tested. Some sites like Everlywell partner with clinicians for result interpretation. Cleveland Clinic notes that results go directly to you, not your insurance initially. This is faster than waiting weeks for a referral. But remember, online results still need professional review before acting. When results come back, here's what you're reading. Mayo Clinic explains, positive RF or anti-CCP antibodies suggest RA, but aren't a diagnosis alone. Elevated ESR or CRP means there's inflammation somewhere, but that could be RA or something else entirely. The NIH emphasizes these are clues, not proof. A high number doesn't mean severe RA. Low doesn't mean you're fine. MedlinePlus recommends discussing results with a rheumatologist or your doctor. They interpret your full picture, your symptoms, test numbers, and imaging. That's where diagnosis actually happens. If your results are positive or unclear, here's what happens next. Cleveland Clinic recommends seeing a rheumatologist within 6 weeks for proper diagnosis and treatment planning. Early treatment makes a huge difference preventing joint damage. This part is critical. Your rheumatologist will likely order imaging like X-rays or ultrasound to check for actual joint damage. They might repeat blood work to confirm results. Don't treat online results as a finished diagnosis. They're your starting point, your conversation opener with a real clinician who decides what to do. So here's the recap. RA blood tests cost $150 to $800 depending on where you go. You can order online through Quest, LabCorp, or other direct-to-consumer labs without a doctor. The process takes about a week, start to finish. Results give you clues, not a diagnosis. And early detection gives you the best chance at managing RA before it causes lasting damage. If this helped you understand your options, hit that subscribe button and turn on notifications so you don't miss our next health test breakdown. Now here's the thing. What type of health tests are you interested in? Comment below and we will make a video about it.